I am obviously female, but I weigh about 103. My blood pressure is always pretty low. I was wondering, is that a concern? It's usually like around 97 over 60, or it's even been lower than that. Is that a problem?
If you are able to stand upright and do the things you need to do, your blood pressure is fine. The lower, the better, as long as you're feeling well. My blood pressure runs about what yours does.
Excellent. Thank you for that, Dr. Shenkman. And up next, we have Kaylee. Welcome, Kaylee.
Hi, thank you. Thank you for a wonderful, wonderful presentation. Please, it's a couple of things related to AMLO. What is AMLO? Are there contraindications for it? What does it do? And is it related to amlodipine? Because I had a horrendous experience with amlodipine.
All right. AMLO and amlodipine, fortunately, have nothing to do with one another. As for the details of what AMLA is, I honestly, I don't know the details of that. So I apologize. I can't answer that question. I do know that it does naturally lower blood pressure. I'm sorry, it naturally lowers cholesterol. My bad.
Excellent. Thank you for answering that. And now we've got Stephen F. Welcome, Stephen.
Hi. Thank you, Ben. Doctor, the other night we had this panel with Dr. Joel Kahn and some other cardiologists and Dr. Baxter and some doctors and some researchers that were questioning the standard of care when it comes to prescribing statin drugs, that they were well less than 2% effective, and that you would have to treat 500 or 1,000 patient years to prevent one heart attack or stroke. And all they kept saying was that this information is not something that is routinely shared with patients. All they're told is you have to take this or you'll die. That's my question.
Okay. You have to take this or you'll die is a horrible way to tell somebody to take medication. As I talked about, it's about shared decision making. So we discuss what the risk of or what the benefit of a statin would be. So it depends on the patient population. You mentioned the number needed to treat. So the number of people who need to get a statin pill to get a benefit, it depends on what their underlying conditions are. Now, somebody who is otherwise healthy, who's walking around and running marathons and has an LDL cholesterol of 120, you would have to take like more than 1,000 of them and put them on a statin for 10 years to prevent one event. Yes, that is correct. That is somebody who would not benefit from a statin. However, somebody who has already had a heart attack and stroke, there is no question that the number needed to treat is significantly lower in order to reduce the risk of that person having another event. And it's always a gray area. And again, it's a conversation that I have with every patient before I put them on a statin. This was why we're doing it. This is why your risk is high and why a statin will help to reduce your risk. If somebody who's a lower risk person, I'm not going to push a statin at them, but it's always a shared conversation where we talk about the risks and the benefits.
Thanks very much, Dr. Shenkman. And now we have a question coming in from Sky. Hi, Sky.
Hi, how are you? Thank you, Dr. Shenkman. I have a question. So I've only been a nurse for 2 years, but I have in that time seen quite a few patients come through our rehab center with rhabdomyolysis. And my question about statins is I've heard that it does deplete the coenzyme 10, which is what causes the rhabdomyolysis. Do you suggest your patients take coenzyme along with the statins when you prescribe it?
It's a good question. Yes, it does deplete coenzyme Q10, but we don't have really good data that shows that coenzyme Q10 supplementation reduces the risk of muscle aches. The data just really isn't there, even though there have been trials looking at it. I think it's a reasonable thing to do if somebody wishes to take a coenzyme CoQ10 supplement. I think it's a reasonable thing to do, but it's certainly not mandatory.
Excellent. Thank you for that. And we have a question now from Ainsley. Welcome, Ainsley.
Hey, everybody. Good afternoon. Doctor, is there a safe salt for us to use on our foods? What is your favorite salt of preference? Himalayan, sea salt, regular salt, free salt that we get in the packets from the grocery? Talk to us.
I personally don't add a lot of salt to my food. I would say that use the salt that you like the best. There's really no data to show that one salt is better than another when it comes to the heart, but certainly you want to be judicious in your use of any salt in cooking.
Great. Thanks very much for that. And so at the moment, I don't have any more raised hands. I've got a few questions for you, and maybe we'll see if anybody else wants to raise their hand along the way. And so if that's okay, I'll jump in. I am wondering, where was the one I wanted to ask you about? For people, I guess the question is, and you may have covered this, but tell us a little bit more. Does diet help for someone who's having chest pains and heart issues, or is it too late for them and they absolutely need stents and surgery?
I think it really depends on where the chest pain is coming from, but diet changes are always appropriate at any time along the whole continuum of this. But if somebody is having chest pain, that's not a situation where you say, oh, I'm going to go vegan, or I'm going to go eat some fruits and vegetables, I'm going to be better. If you're having chest pain, you need to be evaluated by a doctor.
That certainly seems to make a lot of sense. And actually a hand got raised while we were doing that. So I will unmute Stephanie. Welcome, Stephanie.
Hi, doctor. Thank you for answering our questions. My question is, I'm on amlodipine and metoprolol, and of course, I've adopted this plant-based lifestyle in hopes of weaning off or getting off of those medications. But I read something the other day that was kind of scary. It said that if you get off of metoprolol, like just get off of it, it can cause a heart attack, I guess, or whatever. So I was wondering, in your opinion, what's the safest way to get off of a drug that you're on for like a tachycardia or something, or in high blood pressure? And is there a best way to get off of medications?
Before you even think about stopping the medication, talk to your doctor, see if there's a good reason why you should be on that metoprolol and if it can be substituted for something else. Now, stopping metoprolol isn't necessarily going to cause a heart attack, but what happens is your body is withdrawing from the beta blocking effect of the metoprolol. So you can actually have an increased risk of arrhythmias, an increased risk of heart attack. When I take patients off of metoprolol, what I will typically do is I will have them gradually wean off of it. So we might go down to like a half of a tablet for a week and then stop the tablet entirely. But before you even think about stopping the medicine, please talk to your doctor.
Excellent. Thank you very much. And now we have Aaron, welcome. Oh, hang on. Let me unmute you one more time. Hi, Aaron.
Hi, can you hear me?
Yes, thank you.
Hi, so I asked a question before, but this is a kind of a follow-up question to a question that's been asked about the omega-3 score. So I diagnosed in my blood test as a serious deficiency of omega-3. I've been told that the number should be 5 and my number is just 1. And as a vegan, I don't want to use fish oil pills. And I've heard that the DHA from algae tend to be very oxidation issues. What would be your recommendation to deal with the serious omega-3 deficiency? And does it might affect the heart health?
It's a good question. And I want you to definitely talk to your doctor who's ordering the omega-3 levels as to what they think you should do to replete your omega-3 levels. As for oxidation and algae-based omega-3, that's not something I've heard. And personally, I actually do take an algae-based omega-3 on a daily basis for my own health. But I would talk to your doctor.